Good morning, friends. And I think it's time for me to answer some of those scar questions that people have been inquiring about. So I'm going to give my little run through before I get into the questions. The first and the most important thing about scar treatments with any type of device, and contrary to common thought, is that the earlier you treat, the better. In fact, if you know you are someone who is susceptible to hypertrophic scarring, thick scars, or keloids, even thicker scars, or persistent redness or brownness, you want to preemptively strike those scars, usually right after stitch removal. So usually 2 to 4 to 6 weeks is really the best time. As I always say, it's better to clean up your room early before it becomes a total overhaul. And the longer a scar stays, the longer the scar stays. You could often need several types of treatments with old scars, where in the earlier stages of healing, there are simple lasers like the one you saw, pulse dye laser, that could not only put things on the right track if they're not going right, but also optimize the healing process. And study after study show this. There is an old plastic surgery adage that give it a year, let it wait. I always say, listen, if you're redoing your apartment and something is not going right, you don't wait for the contractors to leave the job before you try and bring them back. You want them while they're on the job to get things in order and optimize the end result. And it's the same thing with inflammation and collagen building. Your body's working so hard after trauma to get things right. So anything we can do from the outside to optimize that outcome, the time is always now. So what do? Pulse dye lasers are a gold standard. You could use any type of vascular laser. You want to rule out any other type of infection. Things in a moist environment always heal well. If there's any other types of pigment, like in darker skin types, we can use pico lasers. We often use fractional technologies, both non-ablative and ablative, as the scars get older, or if there are textural abnormalities. And finally, there's always cosmetic tattooing for things like white scars. So I'm going to get into it. Ultimately, you have to realize, as with any cosmetic or aesthetic anomaly, there is no one best treatment, particularly with scars. You have to see a provider that has several options available. Often the combination is going to give you the best results. So if you only have a hammer, everything looks like a nail. Let's get into those questions. Facelift scars? Absolutely. You're investing so much time and money into facial surgery. You should absolutely have a laser surgeon look at your scars starting at about 4 weeks after. Many treatments available. C-sections and tummy tuck scars are probably the most common surgical scars that I treat. Always V-beam them at 2 to 4 weeks. Sometimes we use pico lasers. You can do it while you're breastfeeding. Does the V-beam treat all types of scars? That was the laser in the video. The answer is no. The V-beam, although the most common, should only be used for red and raised scars. It's usually an early treatment. The oldest scars. Well, people with old, like box scar, deep textural scars with pits, it's very difficult to treat those type of old bound down scars. So you got to kind of pull out all the tricks on them, but you can make improvement. A thick burn scar is definitely going to take a combination of treatments. First of all, if it's thick, you're definitely going to need some cortisone or Kenalog treatments that you could use in conjunction with V-beam and things like that. Once it gets flat, you could do other types of resurfacing, but you definitely want to get on that one. Yes, you can fix a thin white scar, but you know what? Unless I really think I can make at least a 50 to 60% improvement with technologies, in a situation like that, I would go straight to cosmetic tattooing, which we do in my office. It really works well. How many treatments always depends on the type of scar and what's being used. But I've never seen a scar that was really one and done. What kind of scars could be treated? Every type of scar can be treated. It's rare that I can't find a way to get the ball in the hole. There really should be no downtime really affecting daily activities. I mean, if you're using it, if it's on the face and you're using lasers and there's redness and downtime, but most people could exercise and do daily things, wear makeup during scar removal treatment. I like this question on surgical scar removal. You really don't want to do surgical revision unless the healing process just really went wrong and the scar will be less than what it started. So that is something for a good surgeon and laser surgeon to decide. The healing process does differ drastically from as little as nothing with a pico or a little bruising with V-beam all the way up to having to keep it covered and bandaged ablatively for a week with something like Fraxel repair. But there is always no pain, no gain. Another question regarding time. You know, it always is several treatments, and there's always no pain, no gain. You're really not going to get much results from treatments that don't have a little bit of downtime or take several treatments. The ultimate result depends on the quality of the scar. Hey friends, that about wraps it up for the scar questions, but I did get a lot of DM questions, and I did want to include them because they are very important before I let you go. Let's start from simple to complex. Scar creams, Dr. Frank, which ones should I use? I'm not going to go into my tirade. Scar creams don't do anything. Be supportive, topical antibiotics, and moisture until it's healed over. But for scars, nothing is going to work. Forget about vitamin E. A lot of people get allergic to vitamin E. It can worsen it. That's really it. You can massage scars. You know, silicone sheets are occlusive. If a scar is raised, it can be helpful. Mild massage. If it's a flat, old scar, silicone gel sheeting is a total waste of time. Next level, PRP. You know how I feel about PRP in the skin. Works great for hair, can be very useful in wound healing, but we're talking about scars. Once the skin is healed and opposed. I have not found that much improvement from injecting PRP into scars. Injecting Botox in and around scars can be helpful, particularly on areas where there is muscle activity, putting tension on a wound. You have to limit tension on a wound, particularly a scar that is hypertrophic or growing. You have to be concerned if you have a scar that is itching and burning. That shows it is in its keloidal formation and will grow. Cortisone shots, 5FU shots, pulse dye lasers. You must treat a scar that feels itching or burning because it's in the growth phase. Let me see. Have we covered all the questions? PRP, no good. Creams, no good. Moving onward, ablative versus non-ablative. Remember, ablative are those laser treatments with big downtime. We use those for surgical scars all the time. Skin cancer scars, when there's a lot of irregularity, we want to do something significant for a scar. Ablative resurfacing can be performed. That being said, sometimes multiple treatments with non-ablative, which is less downtime, and you can put makeup on right afterwards, multiple treatments of that can have equal or more efficacy. And finally, kids, one of my areas of expertise, silicone injection for scars. If you have an indented scar from acne, from trauma, we can use fillers. What are great fillers, right? You don't want to do temporary fillers. You can't constantly do that because it's too cost ineffective. And if you take a hard collagenous scar and you inject a temporary filler, it's like trying to put a water hose to a brick wall. It just goes around it. It can make it worse. But for really deep lipoatrophic scars, fat transfer works great. But also one of my areas of expertise is the injection of medical grade, FDA approved microdroplet silicone oil. Silicone 1000, great product, can be used in conjunction with lasers for indented acne scars. I love doing silicone oil injections with non-ablative Fraxel Dual for acne scars. It works amazing, can be done at the same time. So I think we covered everything, you and me, all right? Amazing new things and procedures coming up.